Janet.
Hi, Clem.
How are you?
I'm alright. I'm kind of worried.
Worried about what?
I just learned about this new lung disease called hepatitis C. Have you heard about it?
Have I heard about it? Girl, I know so much about it.
Oh yeah? Tell me more.
What do you want to know?
The first thing I'd like to know is, what is it?
Hepatitis C. Well, it's infectious disease that affects the liver of an individual, and it's spread by coming in contact with blood of people who are already infected with the hepatitis C virus.
Where does it come from?
It comes from the use of like unsterilized syringes that are used for like injection.
Are there other ways to get it?
Yeah, if you say you come into contact with the blood of an individual who has Hep C, you could get it that way.
What are the symptoms of patients with hepatitis C?
Actually, patients don't show many, if any, symptoms for the Hep C virus. What they may show, if they do show symptoms, would be like a fever, nausea, vomiting, different like symptoms that are shown for lots of other illnesses.
So how do doctors diagnose hepatitis C?
Use a basic blood test to test for hepatitis C.
Are there any treatments for Hep C?
Antibiotics, as well as like a good diet.
What happens if somebody's not caught early enough?
A lot can happen actually. It could lead to liver damage that could like called cirrhosis, which is like basically scarring tissue in the liver. It can also lead to liver cancer if not caught early enough, and it increases risk of different types of cancers in the body as well.
Are there any populations that are particularly susceptible to getting hepatitis C?
Actually, yes, there are. The baby boomer generation of this country, people who like take like, syringes and like syringes off the streets and like unsterilized syringes are at high risk for hepatitis C. And I'd say like internationally, like third world countries are pretty susceptible to hepatitis C. So like West Africa and a lot of Africa from like coast to coast. Russia is pretty susceptible to it.
Is there any particular reason why baby boomers and developing nations are more susceptible to getting hepatitis C?
There's no set reason for baby boomers. In regards to like third world countries, I think just the medical treatment in those countries are lackluster, where like they can't, maybe they don't have the equipment to sterilize all their syringes or something like that. And
so what can people do to decrease their chances of exposure?
Decreasing exposure, I would say, would occur by like avoiding illegal drugs. I guess avoid like using syringes in any way to inject yourself. Avoid coming in contact with individuals who use syringes to inject themselves. Avoiding blood that individuals who use who have hepatitis C have, I guess. So always wear like gloves around bloody situations if you're around any.
So a mother can't give her baby hepatitis C?
If she has hepatitis C, she could pass it down to her child.
What happens to the body when it's infected?
Well, it depends on the stage of infection when it's caught. If it's caught very early on, it can be treated so well that the virus will leave their system and they won't have to deal with it again. If caught not super early enough, but like early enough, it can be treated with and like you can live with the disease.
Mm-hmm.
You can live with the virus. But if it's caught very late, you could develop cancer from it. You could develop scarring tissue in your liver. Yeah, cancer is like, I guess, the worst thing, and cancer could lead to that.
What are the different cancers that someone can get?
Because it's a liver virus, the most common cancer that someone can get from is liver cancer. There have been studies to show also that it's connected to kidney cancer. RCC, which is renal cells carcinoma.
Are there other organs that are affected?
Yeah, it's known to be like small Hodgkin's lymphoma, and just I guess like any organs around like your midsection.
How do you know so much?
What do you mean?
How do you know so much about hepatitis C?
Do
you take a class?
I do, but I looked into it more actually last year. One of my cousins actually passed away because of hepatitis, not because of hepatitis C, but he had hepatitis C and they didn't know about it, doctor didn't know about it, and he went into the hospital with like a headache and lost appetite basically. And they figured out he had hepatitis C, but they caught it too late. So the hepatitis C infected the liver, he got liver cancer from it, and the liver cancer spread to his kidneys. So, and he got kidney cancer, he got RCC from it. So his kidneys failed him at the end and he eventually passed away from the cancer.
I'm sorry. What do you think that physicians can do to better diagnose and recognize the symptoms?
I'd say if you are I'd say like informing their patients on the different, like the risk groups of having the virus. So like my family's nationality is Ghanaian, which is West African. And when I did some research into the Hep C, I found out that Ghana has a huge prevalence of hepatitis C. So after I looked into that, I looked into like how does Hep C occur, and like so it occurs through like contact from blood with the virus, as well as like using syringes or passing down from like a mother to a son. So then I tried to diagnose. I didn't try to diagnose, but I was like, all right, so my cousin came from a pretty poor village, I guess, in Ghana. So maybe he got it from his mother, who got medical attention from a doctor prior to. Maybe he got it from poor medical attention himself before he came to the States, because he came to the States when he was like 18.
Are males more likely to get hepatitis C than females?
I would say they're slightly more likely, but it's pretty even down the spectrum, yeah.
Do doctors need any special type of treatment to treat patients with hepatitis C?
It depends on when the Hep C is caught. If it's caught early on, they don't need a special type of treatment. They could like attack it like they do any other viral infection. I guess a clean diet doesn't hurt in that regard either.
So it sounds like prevention is pretty important to getting to people who have hepatitis C early. Are there any initiatives that have particularly worked?
Not that I've heard of firsthand, but I know after doing research into it, I started looking into different like areas of education. So like to educate the West African of potential for hepatitis C to get screened for it. I try to advocate for that because a simple blood test can diagnose if you have Hep C or not, and if you catch it early enough, it wouldn't lead to cancer down the line.
Is there any way for people who have hepatitis C to track the progression of their illnesses other than going outside the doctor? Is there like apps or websites that can help do this?
That's a really great question. That's something I should look into.
Thank you so much for telling me all that you know about hepatitis C. I feel much more comfortable.
No problem, Janet.